Hello viewers, I am Dr. Himanshu Yadav, DM Cardiologist, currently practicing in Agra. I have my own clinic, VN Heart Care at Shahganj, Agra, and I do my interventions at Upadhyay Hospital and GR Hospital, Agra. Prior to this, I was a consultant cardiologist in Bombay Hospital, Mumbai, and I am an alumni of King George Medical University, Lucknow. Look, whenever we have a patient who is admitted with heart failure, then many a times attendants come to us and ask that what is the diagnosis of the patient. Then we never say that it is heart failure. कि जब भी हम बोलते हैं कि ये हार्ट फेलियर है तो एकदम सामने वाले अटेंडेंट्स को हार्ट अटैक आ जाता है. अच्छा, हार्ट फेल हो गया, बेकार हो गया, अब क्या करेंगे? तो ये समझना जरूरी है कि हार्ट फेलियर केवल एक बीमारी का नाम है. इसका मतलब ये नहीं कि हार्ट फेल हो गया, हार्ट बेकार हो गया, अब नया हार्ट लगाने की जरूरत है. इट इज अ एंटिटी, इट इज अ कॉन्स्टिट्यूशन ऑफ सिम्टम्स. इसको मिला के हम बोलते हैं कि हार्ट फेलियर है. कॉन्स्टिट्यूशन ऑफ सिम्टम्स में होता है कि पहले शुरुआत में चलने पर, काम करने पर, सीढ़ी चढ़ने पर सांस फूलना, पैरों में सूजन आना, रात में जब लेटते हैं तब ज्यादा सांस का उखड़ना या फिर अचानक सांस की वजह से उठ के बैठना, थकान महसूस होना पहले के मुकाबले ज्यादा, पेट में भारीपन महसूस होना, ये सारे सिम्टम्स होते हैं. जिसके साथ फिर हम कुछ बेसिक इवैल्यूएशन करते हैं पेशेंट का. ECG और ब्लड टेस्ट होता है जिसको एंटी-प्रोबीएनपी बोलते हैं. ये सारे सिम्टम्स को कोरिलेट करके हम बोलते हैं कि हार्ट फेलियर है. और हार्ट फेलियर किसी बिल्कुल अच्छे, हेल्दी, चलते फिरते इंसान में भी हार्ट फेलियर के सिम्टम्स हो सकते हैं और बहुत कॉमनली पाए जाते हैं. तो इसलिए हार्ट फेलियर एक तरीके से हार्ट को कोई स्ट्रेस पड़ रहा है उसका इंडिकेशन है. इसका मतलब ये नहीं कि हार्ट बेकार हो गया. Any patient, there are many risk factors for developing heart failure. Number one risk for that is of course age. Any patient who is more than 60 years of age is more at risk of developing heart failure as compared to younger patients. Then there is diabetes, hypertension, smoking, obesity, lack of physical exercise, and then there are various factors in old age like atrial fibrillation, myocarditis. So all these factors are risk factors for heart failure, and most of these risk factors are common risk factors with heart attack. The first most important thing in treatment of heart failure is recognizing it at the correct time and diagnosing it properly. So many patients who have fatigue, undue fatigue on walking, they usually ignore their symptoms for a very long time, and they think that it is just कि बस कमजोरी आई हुई है, and they do not report to the doctor. And sometimes it also happens commonly that the doctor is not able to recognize or diagnose the case because of the vague symptoms that sometimes the patient presents with. So it is very important from patient's point of view to report to the doctor if he has any symptoms like dyspnea or breathlessness on walking, fatigue on walking, any pedal edema, any night cough. So these are the common symptoms of heart failure. So the patient should report to the doctor. The doctor should be well versed with the symptoms, should be able to recognize these symptoms, do the correct investigations in the form of echocardiography and NT-proBNP testing. And once we reach to a diagnosis of heart failure, then most commonly it is then there are many things that we think about it, that what is the cause of heart failure, what is the precipitating factor for heart failure, and then we prescribe the medicines accordingly for symptomatic relief and also addressing the cause of heart failure. Is coronary artery disease a cause of heart failure? Overall, we prescribe do the medical management first, and most of the patients respond well with the medical management only and do not require any surgery, any intervention or any operative procedures. This is the way to go, but obviously every patient is a different ball game, and the approach is different for different patients. My message to all those patients who have a diagnosis of heart failure is that they should strictly adhere to their medication. They should not skip the medicines. They should be vigilant about their salt and water intake. To most of these patients, we advise restriction of salt and water intake, different restrictions to different patients. So whatever has been advised to you, strictly adhere to it. Take your medicines properly. Third advice is that these patients should take their weight every week. If there is an increase in weight of more than 1 kilogram in a week, then they should report to the doctor. Fourthly, these patients specifically have to avoid any pneumonia or viral illness, especially corona in these times. Heart failure patients are the patients at greatest risk of developing complications due to these corona. So they should be more vigilant about this disease in this pandemic going on. So these are the my advices to these patients. If they will stick to the basics, then they can lead a very good and healthy lifestyle. So the best way to make a heart strong is not medication, is not treatment. If you ask me only in one line and one way of making a heart stronger is, I would say that do regular physical exercise. Those who have heart failure, those who do not have heart failure, those who are healthy, those who are not healthy, young, old, be it any category. Number one mantra for a healthy heart is do regular physical exercises every day, at least 30 minutes a day. If you are weak, if you have heart failure, then obviously your potential for doing exercise is less. So do it gradually, do it in a guarded manner, do it under the supervision of someone, but do not skip it. Always try to do it and gradually improve your stamina. So that is the most important way of making a heart healthy.